Anyone age 65 or older or with a compromised immune system should get another dose of their Pfizer vaccine. That's what the CDC recommends. It's also okaying boosters for adults with certain health conditions and working in high-risk settings. But what if you just want another dose? And what does this really say about how the vaccine is working? Abby Larico reports.
About 60 million people are now eligible for additional doses, but what about the 40 million others who rolled up their sleeves for the Pfizer COVID-19 vaccine? We asked Dr. Rachel Presti at Washington University, why isn't a third dose approved for everyone who wants one?
Because we don't have data with a third dose of Pfizer in the younger, healthier population, I think that's a lot of the reason why there's caution.
Meaning we just don't know if it's necessary or helpful right now. The CDC okayed booster doses for people who work or live in high-risk situations, but left that guidance pretty vague. And the doses are being administered on the honor system. So there's nothing to stop you from going and getting another shot if you feel like you need extra protection. However, it's a good idea to talk to your doctor first.
Your doctor's going to be able to tell you from what you're doing and what your underlying medical conditions are, how much risk you're actually at.
How about for those who got a breakthrough case, who tested positive for COVID-19 despite being fully vaccinated with Pfizer's shot? The antibodies that come with an infection are kind of like their own booster. However, it's harder to know how effective. This is another thing you'll want to talk to your doctor about since there's no general rule at this point.
And I will say most of the time when we tell people that yes, you should go ahead and get a vaccine or you should go ahead and get a booster if they've had an infection, we do usually recommend that you wait 3 months or so until your immune system is kind of calmed down.
Doctors say even with talk of boosters, the vaccinations still work. Remember, for most people under age 65 or with healthy immune systems, those first 2 doses are still proving to be the most important when it comes to staying out of the COVID ward during this pandemic. I'm Abby Larico, 5 on your side.